A fast-moving Ebola outbreak overseas is growing this morning, and now the CDC confirms an American has tested positive after being exposed while working in the Democratic Republic of Congo. Health officials say the risk to the U.S. public remains low, but the World Health Organization is warning about the speed and scale of this outbreak. Here's where we stand at this hour. So far, 33 Ebola cases have been confirmed, with that number expected to go up as more suspected cases are tested. Right now, health officials in Congo report 516 suspected cases and 131 outbreak-linked deaths. This includes 26 additional suspected deaths recorded in a 24-hour period. This all happening as the rare hantavirus is being watched across several countries as well. Yesterday, the cruise ship at the center of that outbreak docked at the Dutch port of Rotterdam for disinfection. European health officials now list 12 total cases, including 9 confirmed and 3 deaths, but they continue to describe the risk to the general population again as very low. Time to welcome back Dr. Jodie Guest, Senior Vice Chair of Epidemiology at Emory University's Rollins School of Public Health. All right, so Dr. Jodie, we now have gone from several hundred suspected cases to more than 500 talking about Ebola. With the WHO warning about the speed and scale of this outbreak, what does that tell us about where this response stands right now?
Well, it tells us a couple of things. First, this virus has been circulating for multiple weeks, unknown, and so we are likely to see an increasing number of cases continuing every single day for the next several weeks. Unfortunately, it also tells you how transmissible this is if you are in contact with someone who has symptoms of Ebola.
So what makes this particular Ebola strain different from the strain a lot of people remember from past outbreaks?
This strain is not commonly associated with a bunch of outbreaks that we've seen, and what's problematic is that we do not have any treatment for this particular strain. We don't have a vaccine, and we don't have any antivirals that are specific for it. So as a result, it's really about contact tracing and containment, and then supportive care with this particular strain.
Tell us, what are some of the biggest red flags that epidemiologists look out for in, let's just say, the first week of an outbreak like this, keeping in mind that it had been on the radar, just unknown for a little while too?
Exactly. So you want to be looking particularly at healthcare workers and family members who are caregivers during this time. A person who has Ebola is infectious through their bodily fluids, and they are still infectious at the time of their burial. And so burial procedures are also a place of constant transmission for this. But our first line risk is usually healthcare workers during an Ebola outbreak. We also want to be really cognizant of the fact that our response in the United States is more limited than we would normally, the role we would normally be playing, because of the fact that we withdrew from the WHO. And that is alarming for us, as we really like to be front and center in these outbreaks and thought leaders internationally in providing scientific expertise.
I'm so glad you brought that up. I was just thinking that. So now we have 2 different outbreaks here that we're watching, and being withdrawn from WHO, it seems like, there's aspects of this thing where we could be in the dark. But for the general public, let's explain in the simplest terms the difference between this Ebola outbreak and the hantavirus, because when you go on social media, people are kind of linking the two.
Absolutely. And that's, we're following both at the exact same time, which is unusual to have 2 outbreaks like this making headlines. The hantavirus is an extremely rare virus, and it is one of the only strains of the 40 different types of hantavirus that can actually be transmitted person to person. It happens to be that it got on a cruise ship, and so it had a very contained space to transmit. So we are following multiple cases, and it is a health emergency for those who are on the cruise ship. The likelihood that anyone who is not on that cruise ship will get that particular strain of hantavirus is extremely low. And so far, we've not seen any transmission to anyone who is not on that cruise ship. So that's the good news. Ebola, on the other hand, is a better known transmissible virus, and it is much more contagious to people that you're in contact with bodily fluids. Both of them have a fairly high fatality rate, but hantavirus is going to affect many fewer people than the Ebola outbreak.
And still, with the risk being low, it's something that we want to be knowledgeable about. So we thank you for being here with us this morning and sharing in on your expertise.
Absolutely. Thank you for having me.
All right, Dr. Jodie, thank you again.